Precision for Women est un podcast dédié à la médecine de précision et à la santé des femmes. Vous y retrouverez régulièrement des témoignages et des interviews des femmes et des hommes qui constituent l'actualité de ces deux disciplines. Je suis Norbert Nabé, votre hôte. Soyez les bienvenus. Aujourd'hui, nous sommes en compagnie de Juan Diego Villegas Etcheverry, qui est gynécologue obstétricien à Pereira en Colombie et qui préside par ailleurs la section chirurgie non oncologique de la FIGO. Bonjour Jide.
Thank you for having me today. It's a pleasure to be here. And as you said, my name is J.D. Villegas. I'm an obstetrics and gynecological practitioner. I'm from a city called Pereira in Colombia, in South America.
First of all, maybe some words about the Colombian healthcare system and what are the main topics in healthcare, women healthcare, of course.
Okay, Colombia has a strong health system. We changed our system back in 1990s, and now we have almost universal coverage for our population. Around 97.8% of the population is covered by the national system. Mm-hmm. We have three kind of population that is included in the system. People that is working and pay for part of their healthcare. Mm-hmm. People that is not working and is supported by the system. The second group is the people that is not working or they're underserved. They are covered by the system. And the third category is those that are not in the system. The system is the same for the three kind of people. And if you can afford an insurance or a little bit more coverage that is going to give you you get easier to get a doctor, you get easier into the ER, the surgery is going to be faster. And
you get a single room and all that.
You get a single room and you get a bigger room with a TV and you can be with your family. The medication, all the treatments, and that's all covered by the system.
All right. Does it include prevention, for example?
The primary care is really important for the Colombian system because it means that if you're doing a good work in the primary care, you're going to be saving money in long-term treatments and surgeries and things like that. So they put a lot of effort in the primary care.
One thing shared by everyone, unfortunately, is pain. I know that it's one of your specialty.
Yeah, I think that's really important because, as you said, that's what I do in my regular practice. I'm a doctor that's dedicated to see patients with chronic pelvic pain.
Yeah.
And probably the most important message that I would like to give today is that we as health providers, but also the general population, need to understand that pelvic pain is not normal. And let me tell you why. Yeah. When a patient comes to my office because she's in pain, I usually ask, how long have you been in pain? They say, okay, doctor, I've been in pain for the last 2 years. Okay, and did you have menstrual pain during your periods before that? And the usual answer from the patient is, oh, doctor, that's a normal pain. So not only for patients, but also for doctors and for the society, having pain is normal. To have pain during menses is normal. To have pain during intercourse is normal. Sometimes society says, you know what, you're a woman and you just don't want to work. You want to leave your work for 3 or 4 days per month. You don't want to have sex with your husband. You're just weak and we won't hire you because you will be out of your job for 3 days a month. And it has a lot of discrimination because of the pain. And society doesn't understand that. And not only society, health providers. It is really frequent for women that they go to see several doctors that keep telling them, you know what, you don't have a problem. Maybe the pain is in your head. Maybe you're making that up. Why don't you just have a kid? If you get a kid, if you get pregnant, you're going to get better. And that's a really bad message for our patients because having pain is not normal. 1 in every 4 women in the world have chronic pelvic pain, and 80% of them are underserved. They don't get a diagnosis, they don't get a treatment. Less than 15% of health providers say that they like to see patients with chronic pelvic pain. So that's a big issue, and we need to build awareness around that. This is a problem for rich countries and poor countries. This is a problem everywhere, in the United States, in Canada, in Europe, in the Middle East, in Africa, of course in Latin America. Patients are, all of them, underserved. And of course, endometriosis is a big chunk of that problem. And that's why we need to work in probably 3 pillars that are really important: access, advocacy, and awareness. And what I think is that we need to teach patients that they have a voice, and they have to keep asking doctors. If we let patients be empowered and go to see a doctor with pain and say, "Doctor, I have pain and I cannot work and I need help from you." And if the doctor says, "You're fine, you're just making that up, you're crazy," patients need to know that they can find another provider that is going to believe in them and do things for them to have a better care and a better treatment and enhance their quality of life and be able to fulfill their day-to-day roles. Because that's part of the change. Because we need to, of course, educate doctors about this. But we need also to educate patients. Because doctors, we are in a position that things that we say are the whole truth for patients.
I think it's tough because it's good to keep the good relationships between patients and doctor. To your opinion, to your experience, do you see things moving nowadays, or do you think it's going to take something like 10 more years to improve this situation?
I think things are moving forward, and I think things are really changing. Let me just tell you this story. I've been doing this for 20 years now. That's a lot. That's a lot of time. And the first international meeting that I attend, it was in Sydney, in Australia, probably in 2008. And in the room, we were going to be talking about chronic pelvic pain. And in the room, we had 5 people attending. Just 5 doctors were sitting there listening to a bunch of crazy guys talking about chronic pelvic pain. During this congress, we've done several sessions on chronic pelvic pain, and we had, on average, 150 people sitting down listening to our message on chronic pelvic pain. So I think the awareness is growing big, and endometriosis has been a big part of the new awareness that doctors and patients have about chronic pelvic pain. Because we talk about that, and patients talk about that, and on their laws in different countries in the world about endometriosis. So that awareness is growing, and probably endometriosis is pushing that forward in a big manner. I can tell that there's a lot of work to be done. There's a lot of campaigning that we still need to do. And what you said earlier is really important. This is not a fight between good doctors and bad doctors. I think we need to learn all together. When a doctor says that you don't have real conditions when you have pain, it's not because the doctor is bad. It's not because he wants or she wants to hurt someone. It's because they don't know. They need to know. And the patient's pressure is really important. So this is not a fight between good and bad. This is really important for patients.
All right, but in the daily practice, what does that mean? This awareness and this commitment, how it's concretely changed things.
Let me show you some data. We published a few years ago a paper that says that a patient with chronic pelvic pain that comes to see a doctor, and the doctor says, "You know what? I believe you. I know that you're not crazy. I know that you're sick. And I'm going to try to give you options to make your quality of life better." That patient, she didn't get a surgery. She didn't get any medication. She just got that from the doctor. And she's going to feel better after that first consultation. Patients don't just need to be heard. They just need to be believed. patients need someone that says, you know what, you're not crazy, and there are options for you to be better, to have better quality of life, to be able to fulfill your day-to-day roles.
You were talking also about the law that goes in Colombia that change everything for patients. It is the same kind of idea.
Yeah,
at the end.
Colombia just worked in a law of endometriosis that was worked from the patient's perspective. The Association of Patients with Endometriosis in Colombia got together and worked to get a endometriosis law in the Senate. That is really important because it's giving patients a voice. They cannot afford anymore just to be sitting in their houses with pain, not being able to work, not being able to get a life. And health system saying that, you know what, there's nothing to do with you. You know what, don't come to my office anymore because I don't have any options for you. You already had a hysterectomy, you already had a salpingo-forectomy. I don't know what else to do with you. Just go away. I don't have any other options. And patients need to get options because the goal of the treatment for patients with chronic pelvic pain is not that they're cured of their pain. And that's really important. I say that to my patients every single day. The goal is that they have a social, working life and family life that is normal, that they can fulfill their roles.
Thank you very much, Gide. It's a huge subject, and I hope that our small podcast will contribute to this awareness.
I really, really appreciate the opportunity because as much as we can talk about this, I think we're going to be really moving forward, pushing things forward to give a better standard of care for women's health and for improving their quality of life. So it was a really pleasure for me, and thanks again for having me.
Thank you very much.
Okay. No, well, thank you. Thank you again for inviting me.
All right. Bye-bye.